Direct Connection is made by MPT to serve all of our diverse communities and is made possible by the generous support of our members. Thank you. Live from Maryland Public Television, this is Direct Connection with Jeff Salkin.
Hi, everybody, and thanks for tuning in for Direct Connection. Coming up tonight, the growing community of cancer survivors. We will find out how doctors and patients are saving lives. First tonight, another tragic collision between a four-wheeled vehicle and a two-wheeled bicycle. How can we prevent more of these crashes? Joining us in the studio is Joshua Feldmark, Executive Director of Bike Maryland. Joshua, thank you for being with us.
Thank you very much for having me.
Latest incident was a week ago. It was a 20-year-old man hit in Baltimore County. How does the cycling community, your group, respond to cases like this?
Yeah, well, I mean, there's a couple of important answers to that. The first is that we do want to take this moment and be aware of Aaron and Aaron, the kid who was struck and killed, and not go through that and learn about him. And of course, I didn't know him personally, but just show that he was part of this cycling community, and show the support to the family and give them what they need. But also, this is a moment for us to really try and raise awareness and say that there are cyclists on these roads, and we are taking our lives into our hands, and a moment to try and raise awareness around safety on the roads.
There are cyclists, there are more cyclists, especially this time of year. There are more vehicles, too. What do drivers need to know about safety involving cyclists?
Well, the best thing in terms of what drivers need to know is to be aware of your surroundings. It is very easy to be lulled into there's 1,000 distractions going on, and you need to be aware as a driver to pay attention. And we as cyclists are going to do everything we can to make ourselves visible, to make ourselves aware. But we're on a piece of metal that weighs a couple of pounds, and you're in one that is 4,000 pounds. So right. to be aware of your surroundings, to know that we're there.
Right. Now, at the same time, the cycling community needs to be aware of safety also. Reportedly, the young man, it was night, and there were no lights, no reflectors. Mm-hmm. What do people on bicycles need to keep in mind?
Well, sure. We need to be aware. We need to maintain safety protocols and obey the law. I think the other point that is worth mentioning here as well is that there is only so much that can be done in our current infrastructure, right? Like we can and should do more to make ourselves visible so that it is easier for drivers to see us. And drivers need to do a lot more in order to be aware of their surroundings, and cyclists are there. But also, we need to build into our infrastructure ways in which everybody using the road, whether you're in a car or on a bike or on your feet or on a scooter, that you can use that road safely, that we can build these streets completely and safely for everybody.
Let me remind our viewers, if you have a question about bike safety or a comment, give us a call. We'll have the number up on the screen. You can also tweet your questions. The Twitter address is @MPT News. Josh, broadly speaking, how bike-friendly is the state of Maryland?
Well, we're about to get a better answer for that because they are filling out, as we speak, Maryland Department of Transportation is filling out a survey that goes to the League of American Bicyclists, who rates us as a state. We are somewhere in the middle of the pack, sort of. That's a loose conjecture on my part, but there are a lot of states that are doing a lot to build in infrastructure, and we have been falling relatively short. And this goes back, several years.
Let's grab a phone call from Baltimore City. This is Robert. Robert, thanks for the call. Go ahead.
Thanks, Jeff. I was concerned about the visibility of cyclists. I'm not a cyclist. I'm a driver, though. And I think that the use of the small white strobe light, front and back, on the bicycle should be law. You cannot see easily, looking through a car with traffic and parked cars nearby, a slender person in black lycra spandex on a skinny black bike. They're almost invisible, and they have no horns.
Robert, thank you. Good question. What would you think about that as a law being mandatory?
Sure, I'm absolutely open to, and we as the cycling community are open to this idea that that there is some responsibility that should be legal to say how can we make cycling safe, and putting in the infrastructure on the bikes for us riders to make sure that we are safe. But that also doesn't mean that that there is a sort of passing of the responsibility. Again, when you're in as a driver, I drove here. I spend more than my fair share in a car. I'm in a car more than I am in a bike, and to know that it is the driver's responsibility to be aware of the surroundings.
I know you're relatively new in this position, so I don't know if you know all the legal ins and outs, but what laws do bicycle riders have to obey? I mean, you'll see bicyclists on city streets, but sometimes you'll see them flying through crosswalks too, right. or maneuvering between cars. What's the law?
Yeah, well, I'm gonna not answer your question just because there's no easy answer to that question. It changes depending on the jurisdiction, and there are a series of state laws. Sometimes cyclists are treated as cars, and sometimes they're treated as the same as pedestrians, and that changes depending on the scenario.
Let's take a call from Allegheny County. This is Lisa. Lisa, thank you for calling. Go ahead.
Yeah, I'm curious to know if the driver's education classes, especially in cities, focus a portion of their training on bicycle awareness and
Good question. That was a long time ago for me, so I don't recall. Do you know?
It was probably less time for me, but not by a whole lot. There is very little focus in driver's education on bicycling and pedestrian safety. There is some focus on the laws, and there is, to my feeling, there needs to be much more focus on not just car-to-car interaction, but car-to-bike, car-to-pedestrian interaction in driver's education.
Let's talk about bike lanes a little bit. There's obviously a whole lot more of them than there used to be, but it's a small percentage of roads and highways that have a bike lane. So we're in this in-between period, and I'm not sure that anybody was taught about that in driver's ed either.
Right. Yeah, no, and that's absolutely true, and that's the process of building up your infrastructure, and that's what's so important. And I think we're going to be getting more and more bike lanes, and then more and more people are going to be using them, which will create more demand for them, and eventually we're going to see the promulgation of protected bike lanes, where there are actually barriers, hard or soft barriers between the bike lanes and the cars, as is there now anyway in Potomac Avenue, right. and we're going to start seeing that more and more.
Call from Baltimore County. This is Rob. Rob, thank you for the call. Go ahead.
Hi, Jeff. I personally am a rider, and I realize that there are certain roads that you're taking your life in your own hands. Delaney Valley Road, Cromwell Bridge Road, and I would suggest Charles Street, where the cars, very often there's no shoulder. Cars are coming along at 50 or 60 miles per hour. And, I mean, I'm on a bike. I look around constantly because I'm aware of it. But I've seen a lot of other bicycle riders just ride along, and they get into a state of zen. And it's just like, what's their responsibility? I'm a rider myself.
So, Rob, where do you ride?
I try to ride when there's no rush hour. I try, if I have a day off or whatever, I try to get in at 10 o'clock in the morning on certain roads, Providence Road, some of the other roads where I know where there are shoulders. But generally speaking, I mean, I know what the chances are of an accident, and it could be me, even if I'm highly aware.
Very good. Thank you for the phone call.
And I don't necessarily even want to get into a whose fault it is or any of that. I think the answer to what he's talking about is that our roads should be safe for all forms of transportation, and that if those roads are not safe as a cyclist, that's a problem, and we need to build up our infrastructure so that he can bike at rush hour, because if he's biking at rush hour, it means he's not driving at rush hour, which means there's one less car at rush hour.
I don't want to totally put this on the biking community, but because certainly there have been crashes, fatal crashes involving drunk drivers, for example. But do bicycle riders ever get tickets? Do you ever see somebody get pulled over and issued a citation for
I've never seen it.
It
does happen for sure. I've not seen it. But
there's no sort of, there's no license, there's no test, there's no insurance requirement before you head out on a bicycle.
Right. I think if there's more often than not, what you're going to get if there's a cop who witnesses a cyclist breaking a law, you're probably going to get a warning of some sort.
And he's going to be in a car and unable to catch up anyway.
Right. Well, it depends on the jurisdiction. There are more cops on cars now, on bikes now too. So they might catch you.
Let's go out to Harford County. This is Donna. Donna, thank you for the call. Go ahead.
Yeah, hi. I was in Germany in March, and obviously biking is a bigger deal just for regular commuting than it is here in the States. But what I thought was interesting was the sidewalks were much wider than ours, and the bikers lane was sort of like the street, the street half of the sidewalk closest to the street. And I mean, it was like our tour guide kept saying, "Watch out for the bikes! Watch out for the bikes!" I mean, they use those lanes like crazy. There also was some bike lanes in the street, but in Berlin especially, there were huge bike lanes on the sidewalk.
Mm-hmm. Thanks very much. And you think about all the infrastructure needs, just keeping up with stuff that's falling apart. Sure. But at the same time, there's a lot of effort being put into sometimes controversial things. Baltimore City right now, there's a dispute about taking away parking spaces to add bike lanes.
Yep. Yeah, and not surprisingly, we at Bike Maryland certainly are fully supportive of the protected bike lane and that. And that model, and I think what the caller was getting to is this concept of really building a complete street, and that's again, understanding that you build it for all users, and building the infrastructure that way works for everybody. It works for people who never walk, never get on a bike. Even if you may lose some small handful of parking spaces.
There is a law about giving 3 feet of clearance to a bicycle.
Yep.
When's that apply?
I don't know the specific answers to when that is.
But if you're a driver, you're supposed to give them 3 feet.
And I would say that as a driver, that I simply follow that. 3 feet is that's to me a rule that just follows whether or not you should legally or not. If you're passing a cyclist, wait for the time that you can give them 3 feet of clearance. It's not that hard. It doesn't take that much time out of your day.
As a driver, before you became affiliated with Bike Maryland, did you ever have a close call with a cyclist?
Nothing that I would call as a close call, and I've certainly driven in places where bikes are. I used to work in D.C., so bikes are very prevalent there, and I've never had anything that I would consider a particularly close call.
Let's take a call from Montgomery County. This is John. John, thank you for the call. Go ahead.
Okay, I'm afraid my call is pretty redundant to the previous caller, but I just returned from Copenhagen, Denmark, and with the dedicated bike lanes there, and the statistic was 2 bicycles per occupant or resident of Copenhagen, because they're all over the place.
Well, we appreciate the phone call. We keep up on the travel schedules of our listeners.
And just just throw in one other country just for good measure. In the Netherlands, they had a series of fatal accidents with cars hitting bikes, and went into a full mode where they really changed the entire culture where cars became the less dominant form of transportation, and it was the driver's responsibility at all times to be aware of the cyclists and not the other way around.
Joshua Feldmark is Executive Director of Bike Maryland. Thank you for the visit. We appreciate it.
Thank you very much for having me.
Still to come tonight, why cancer death rates are going down. We'll be right back.
Hi, I'm Larry Unger, here with Judy Woodruff of the PBS NewsHour.
From politics and the economy to health, science, and education, the NewsHour delivers a thorough analysis of current events to help you put the day's news in context.
Judy and the NewsHour team have set the standard for deep and unbiased reporting. We are so pleased to present it as part of our Public Square programming.
Join me on the PBS NewsHour weeknights at 6.
Got an unused vehicle going nowhere? Donate it to the one place that can take you any place. Visit mpt.org/vehicles and support the programs you love on MPT.
The MPT app puts our programs right at your fingertips, so you can choose when to watch, what to watch, wherever you want to watch it. Download it now.
What happens in Japan and Asia matters to me. And with NHK World's newsroom in Tokyo, I get the news live from Japan right at the start of my day.
New ideas come out of Asia all the time. NHK Newsline reports on business, technology, and world events from Tokyo to Bangkok.
Once in the morning gives me a heads up on the competition.
Every hour on the hour, the news I want from Asia.
Watch NHK World now on Comcast Channel 268 and Verizon Channel 480.
And joining us for this week's Your Health segment is Dr. Rima Kuzi, medical oncologist at the University of Maryland St. Joseph Medical Center's Cancer Institute. Doctor, thank you for being with us.
Thank you very much for having me here.
The number on cancer survivorship is really good news. It's 4.8% of the population. It's increasing. Why is that?
Yes, the current estimate of cancer survivors is about 15 million people, and the estimates for 2014 will be about 19 million. So that's great news. That means we're doing better. We're curing more patients. So that's related to early diagnosis and improvement in treatments.
You specialize in breast cancer. In terms of treatment, what do you have today that you didn't have maybe a decade ago?
Many things. We have new targeted therapies, for example, for HER2-positive breast cancers that were not available. Well, they're more mainstream now. We have improvements in hormonal therapy for estrogen receptor-positive breast cancers, improvements in early diagnosis, and improvements for treatments for patients who have advanced cancer, stage 4 disease.
On the early diagnosis front, maybe not everybody is rushing to get their mammograms or, in the case of men, PSA scores. What could you say that would encourage somebody to go do that?
Well, there's very much a direct link between early diagnosis and improvement in outcomes. So I would encourage everybody to discuss the screening guidelines with their physicians and to follow them. There's always a controversy about when you start mammography for women, and it changes between 40 and 45 and 50. But the earliest possible, and you have to factor in also family history and other risk factors.
When someone comes to you with a breast cancer diagnosis, how was it typically found? What first sent that person to the doctor?
Fortunately, most of the cancers that are diagnosed right now are diagnosed by mammography. So a big percentage of the breast cancers are stage 0 and stage 1. So that's good news because they are more curable than advanced stages.
So as the doctor, you'd prefer to see somebody who did not find it in a breast self-exam.
As a lump, somebody who hasn't been getting their mammograms and found a lump, ignored the lump, got bigger. Yes, the earlier it's found, the better.
I wonder if the good news about cure rates maybe makes people feel less incentive to go get the mammogram or do the testing and think, well, maybe, the medical community has this under control. I can wait a little bit.
I don't know. I mean, I think mostly people who don't do it, just they're busy, you know, they're busy with their children, they're busy with life, they're busy with jobs, and they just kind of put it off and think, I feel fine, you know. And it's easy to put it on the back burner, and then you find yourself 2-3 years behind, you know. I don't know that a lot of folks would say, oh, if they found it when it's advanced, I'll still have a good chance. I think it's more just, you know, things get in the way.
Let me remind our viewers, if you have a question about breast cancer or cancer treatment in general, give us a call. We'll have the number up on the screen. You could also tweet your questions. The Twitter address is @MPT News. In terms of cancer broadly, the idea of being able to reduce one's risk, reduce one's exposure,
Yes.
what comes to mind?
Oh, many things. Smoking, big one. Smoking is a major risk factor for lung cancer and many other cancers as well. So smoking cessation is key. It's also associated, obviously, with other health risks, heart disease, osteoporosis, you know, many other things. So that's one thing. Alcohol intake, so alcohol in moderation or low level, because that's also associated with certain illnesses, liver disease, liver cancer. Obesity.
I was going to head there because that is associated with breast cancer.
Yes, and other cancers too. But there is definitely obesity is a risk factor for breast cancer. It's also associated with a worse prognosis at diagnosis. And there's actually some data that suggests also that weight loss after a diagnosis is associated with improvement in the outcomes. Although this has been validated in a large clinical trial, we're actually participating in it to look at women who are just in their survivorship phase. There are studies been looking at to see if weight loss help improve prognosis as well.
Let's take
post-diagnosis.
Good. We'll take a phone call from Baltimore County. This is Judy. Judy, thank you for the call. Go ahead.
My question is regarding mammograms. What are the advantages or disadvantages to a 3D mammogram versus a regular mammogram?
Very good. Thank you very much.
So a 3D mammogram improves the pickup rate. It's still, you know, a standard mammogram is still very good, but a 3D mammogram allows the radiologist to manipulate the images, and they are able to pick up smaller lesions.
Should women be concerned about false positives?
Well, that's also an area of interest and or area of study. There is some concern that, you know, especially in older women, that picking incidental small cancers may not impact on prognosis like a survivor. But it's, you know, it's a bigger topic than I can address today because it's pretty complicated, you know.
We're talking about.
But there's.
Please.
Yeah. No. Sorry. The. You know, you do mammograms, you find things, and you do biopsies, and sometimes, you know, the biopsies are negative, but you also sometimes pick up lesions that are real and lead to treatment.
In terms of ways to lower one's risk,
yes.
Don't smoke, you know, don't be overweight. Does diet play a role, and does it play a role in breast cancer?
Yes, it does. Actually, the obesity has a stronger link with risk of cancer than the type of diet you're on. It doesn't mean you shouldn't eat healthy, but the information has been validated in studies with more weight, you know, so obesity rather than actual type of diet. However, we do recommend that patients eat healthy, that they keep their diets rich in fruits and vegetables and low in saturated fats. Mediterranean diets have been well shown to decrease the risk of cancer. Diets that are keep the red meats low and heavy on plant-based food.
For those people making the 5-year milestone after a cancer diagnosis, you have a survivorship program at St. Joseph Medical Center. What is that?
Well, survivorship actually starts the day you're diagnosed. You know, you're a cancer survivor from the moment you're diagnosed with cancer, because you're actually, that's a formal definition, because you are living with cancer or you're surviving it at that moment. However, when patients have completed their initial phase of treatment, they do have a formal visit where we go over the treatment summary, what they've received, We will go over side effects or symptoms they're still experiencing and what can we do to help them move on, be it physical or emotional. We give them a summary of their treatment. We share it with the primary care physician, and then we kind of outline what it's going to look like over the next few years.
What is the emotional side of that?
Well, it's an emotionally related disease. It's the fear of cancer is the fear of how you're going to do. Are you going to survive it? How are your kids going to be? Your parents, your friends. What's life going to look like for you? So it is a big part of what we do. But it is very important to encourage patients to think of themselves as survivors, not as cancer patients. You don't want it to define you. You don't want to be a cancer patient. You want to be somebody who's had cancer and moved on to become a survivor.
Good place to leave it. Dr. Rima Kuzi, medical oncologist with the University of Maryland, St. Joseph Medical Center's Cancer Institute. Doctor, thank you for the time.
Thank you for having me. Yeah.
We appreciate it. Thursday at this time on Your Money in Business, why attracting dynamic leaders from diverse backgrounds is good for companies and consumers. Join us for that Thursday at 7:30, and then Friday on MPT at 7:30. Join us for State Circle and the latest on Maryland politics. Thanks for watching Direct Connection, and have a good night.
Your health segments are a co-production of Maryland Public Television and the University of Maryland Medical System.
This program was made by MPT to serve all of our diverse communities.